Well, flu season is around the corner, and we know people are already debating whether or not to get the vaccine. We are joined today by primary care physician, Dr. Irina Gagua. Thank you so much for being here, doctor.
Thank you for having me.
So my first question, what is influenza infection?
Okay. So influenza infection is a respiratory illness that is caused by influenza A or B virus. And it occurs in epidemic every year, mainly in winter. Influenza infection can lead to serious complications, especially in elderly, young children, and people with certain medical conditions. So therefore, it is recommended that all individuals 6 months age or older get vaccinated.
So what are some of the myths surrounding flu shots? I'm sure as a doctor you hear them all.
Yes. I have to mention that influenza virus mutates very rapidly.
Okay.
Therefore, last year's vaccination may not be effective against this year's viruses. Therefore, again, it is recommended that individuals get vaccinated every year, a few weeks before the flu season hits, right around the beginning of October. We are already vaccinating patients in the office. And a lot of times patients will ask me, will the vaccine cause the flu?
Yes.
And I say no. After the vaccination, you may get flu-like symptoms, a mild fever, body aches for a few days, but these symptoms are due to your body's defense mechanisms. You may also get soreness around the injection site. It takes a few weeks to build immunity after the vaccination. So if you are exposed to the virus shortly before or after the vaccination, you may get the flu, but not from the vaccine, but the exposure to the virus itself.
Okay, and if people need more information or if they want to contact you about this issue, what should they do?
They can talk to their provider. They can call TriHealth, and we can always provide more information. In fact, I do recommend that folks discuss with their providers about their medical history, including any adverse reactions to the prior vaccinations before getting the vaccination.
Well, thank you so much for being here, doctor, and good luck to you.
Thank you so much.
So remember, the answers you hear from our TriHealth experts are just a good place to start, just as she mentioned. This is not a replacement for advice from your own doctor. Send us your medical questions and a TriHealth doctor will answer it live on the air next Tuesday. Just look for the link at wcpo.com/doc on call to submit your question. We will answer one question every Tuesday.